The largest report ever done on global health has found we're living longer but not better. A 20-year report card is the work of hundreds of organisations across 50 countries, including Australia. It's found an increasing number of our extra years are now marred by poor health. Medical reporter Sophie Scott explains.
More of the world's population is making it to old age, but for many, those later years are spent battling chronic conditions. Professor Alan Lopez from the University of Queensland is one of the lead authors of the World Health Report.
We're living longer, but we're living more of those years with disabling conditions, particularly conditions like low back pain and some of the severe mental health conditions, including depression.
And while infectious diseases such as measles have become less of a public health concern, the incidence of conditions such as cancer and heart disease is rising.
The world in 2010, while it's healthier than it was in 1990, it still is characterised by very high disease burden from some of the leading causes that we know in Australia, like ischemic heart disease, stroke, lung cancer.
Health experts say the increase in chronic diseases isn't simply due to the ageing population. Lifestyle factors such as obesity, tobacco and alcohol use are boosting the risk of health problems later in life.
This study found that hypertension, that is high blood pressure, is the largest health risk for illness and death the world over.
Almost 20% of people who die today die because of suboptimal blood pressure.
Mental illnesses such as depression were the largest contributors to disability around the world.
So this is a major issue and reflects the functional impairment that these conditions cause.
The incidence of Alzheimer's was up by 80% over 20 years, mainly due to an ageing population. Doctors hope the findings will help shape health policy and focus campaigns to reduce the incidence of chronic disease in old age. Sophie Scott, ABC News.